Thank you for tuning in to the Brach Eichler Talks podcast, where we explore and discuss today's trending legal topics. In this episode, we'll discuss a recent article from Brach Eichler's December Healthcare Law Update, titled CMS Finalizes Calendar Year 2026 Medicare Physician Fee Schedule. On October 31st, 2025, the Centers for Medicare and Medicaid Services, CMS, published the calendar year CY 2026 Physician Fee Schedule Final Rule, which takes effect January 1, 2026. The rule updates Medicare Part B payment policies under the Physician Fee Schedule, introduces changes to quality and payment model programs, and reflects a broader focus on efficiency, transparency, and shifting modalities of care. For CY 2026, CMS will use two separate conversion factors, one for practitioners who are qualifying participants, QPs, in Advanced Alternative Payment Models, APMs, and another for non-QPs. The final conversion factor for QPs is approximately $33.57, representing a 3.77% increase over the CY 2025 conversion factor, and the non-QPCF is approximately $33.40, representing a 3.26% increase. The final rule also includes an efficiency adjustment of minus 2.5% for non-time-based services, reflecting CMS's view that certain services have become more efficient over time, and thus their relative value requires adjustment. For providers who offer telehealth services, CMS has streamlined the process for adding services to the Medicare telehealth services list, eliminating the prior provisional versus permanent distinction and reducing review steps for whether a service furnished via interactive, two-way audio-video qualifies. In addition, the frequency limitations that previously applied to subsequent inpatient visits, nursing facility visits, and critical care consultations delivered by telehealth have been removed. CMS has also finalized rules allowing for direct supervision via real-time audio-video, but not audio only, for most services that previously required the supervising physician to be physically present. Further, FQHCs and rural health clinics will be permitted to bill for telehealth services through 2026. The final rule also updates several policies affecting drugs and biological products covered under Medicare Part B. CMS maintained the existing refund requirements for discarded amounts of certain single-dose or single-use drugs and adopted clarifications to how manufacturers should report pricing and service fee information when calculating average sales price. CMS also confirmed that, beginning in 2026, prices for drugs subject to a maximum fair price will be reflected in Medicare's payment calculations. In addition, CMS finalized operational updates to the Medicare Prescription Drug Inflation-Rebate program aimed at strengthening price inflation guardrails and improving data accuracy for future rebate determinations. For more information, contact Caroline J. Patterson, Member and Vice Chair, Healthcare Law, at 973-364-5233 or cpatterson@bracheichler.com, or Jonathan J. Walzman, Member, Healthcare Law, at 973-403-3120 or jwalzman@bracheichler.com, or Andrew M. Kuder, Associate, Healthcare Law, at 973-403-3141 or akuder@bracheichler.com. Don't forget to subscribe to our podcast on Spotify, Apple Podcasts, and YouTube. Follow us on LinkedIn and Facebook for updates on new episodes. For more information and resources, visit bracheichler.com. This is intended to provide general information, not legal advice. Please contact the authors if you need specific legal advice. Brach Eichler LLC is a full-service law firm based in Roseland, New Jersey, with over 80 attorneys. The firm is focused on the following practice areas: healthcare law, real estate, litigation, trusts and estates, business transactions and financial services, personal injury, criminal defense and government investigations, labor and employment, environmental and land use, family law services, patent, intellectual property, and information technology, real estate tax appeals, tax and cannabis law.